We put out a brain health plan. I refer to this in the context of brain health. Only 24 counties out of 58 have any comprehensive mental health services. It's predicated on first episode focus. It's predicated on early intervention. We begin the plan by saying the focus is on preventing mental health before we punish mental health, and focusing on the fact that over half the incidences are identified before the age of 14, 75% before the age of 24. So it's a focus on screening, on prevention, intervention. The coercion side is on the back end. It's a point of our failure in the system. And so our focus is on prioritizing those interventions early as opposed to punishing and getting into these complicated conversations in the back end.
I think we need to get people care, but we need to get people care that moves them from illness to some reasonable semblance of health. I happen to have some experience with mental illness in my family, and so I know that you can't cure schizophrenia to some degree, or there's some academic discussion about that. Again, I'm not an expert on this, but you can make it functioning, and you can transition people from being on the street to being somewhat productive. That's an element, by the way, of the homeless situation that needs to be dealt with. I do not agree with state-run institutions. I think the state should enforce its vagrancy laws, and by doing that, I think it would be a compulsion.